Hi, welcome to my channel, Fibromyalgia Sucks. Hello there, hope you're all well. Which is pretty much Sod's Law on my channel, I press record and the wind comes and they start digging up the road outside the apartment. So I apologise for the noises, hopefully the sound's a little bit better because I have been fiddling with it. Fingers crossed. Today I wanted to talk about the causes of fibromyalgia and the treatments of fibromyalgia with a couple of other things. Sorry, I just had a look at the screen, it came up saying display off, and I hope that doesn't mean the recording off. I have no faith, excuse me a second. I have no idea if that's recording. Got a new app that I can check. Yes, seems to be recording. Ah well, let's give it a go. Okay, I've had to write it or sort of collate it all together because there's a lot of information to get through. There's no chance that I'll ever remember it, but let's get into it, shall we? Now, depending on who you speak with, the causes of fibromyalgia are broad, wide, varied, to say the least. I'll read what I found, and then obviously if there's anything you want to discuss, do it in the comments below. Causes of fibromyalgia. A painful disease like arthritis or an infection raises your chance of getting fibromyalgia. I had neither of those. Emotional or physical abuse. Children who are abused are more likely to have the condition when they grow up. This may happen because abuse changes the way the brain handles pain and stress. Not a lot to add to that one. Yeah. Personally, I didn't suffer from that, but I know that there are people out there that do, so my apologies. PTSD, post-traumatic stress disorder. A lot of people associate that with, people coming back from the war and whatnot, but what's written here is some people have this mental health problems after a terrible event like war, a car crash, or rape, or something similar. These events are also linked to fibromyalgia in some people. I had to laugh at this one. It's not moving enough. The condition is much more common in people who aren't physically active. Exercise is one of the best treatments of fibromyalgia you already have. It can help turn the pain volume down. Written by somebody that doesn't have fibromyalgia and hasn't had the opportunity to test that theory. Rheumatoid arthritis, which was mentioned a little bit earlier, or other autoimmune diseases such as lupus can also cause people to get fibromyalgia. And central nervous system problems, CNS. I can't go into the CNS because when I started to read into it, it was very complicated. So CNS, central nervous system, if you feel like looking into it yourselves, you're more than welcome. Detailed causes. One of the main theories is that people with fibromyalgia have developed changes in the way the central nervous system processes the pain messages carried around the body. This could be due to changes in chemicals in the nervous system. Some doctors think they know why, a glitch in the way your brain and spinal cord handle pain signals. When you have fibromyalgia, you may have more cells that carry pain signals than normal, and you may have fewer cells that slow pain signals down. This means your pain volume is always turned up, like music blasting on a radio. The result is that a minor bump and bruise hurt more than they should, and you may feel pain from things that shouldn't hurt at all. I'm not smiling because of that, I'm smiling because fireworks have started in the background. I swear to God they wait until I press record. That's how it feels like to me, and that's the only theory I've come up with in sort of 15, 16 years, is that it's the miscommunication in pain signals. I say that because one of the most successful cures I've heard of is a thing that happened in Germany where you were put into an induced coma for 7 days, and I can't remember the percentage. I'm sure a quick internet search will figure it out, but something like 60% of patients either came out pain-free or significantly reduced. And of course, 7 days of sleeping. Who wouldn't like that when you've got fibromyalgia? Here we go. The central nervous system, brain, spinal cord, and nerves transmits information all over your body through a network of specialized cells. Changing in the way this system works may explain why fibromyalgia results in constant feelings of and extreme sensitive to pain. And of course, chemical imbalances. That's the widest statement I've ever heard in my life. Researchers found that people with fibromyalgia have abnormally low levels of the hormones serotonin, noradrenaline, and dopamine in their brains. Low levels of these hormones may be a key factor in the cause of fibromyalgia, as they're important in regulating things such as mood, appetite, sleep, behavior, and your response to stressful situations, like fireworks going off when you're trying to record something. These hormones also play a role in processing pain messages sent by the nerves. Increasing the hormone levels with medication can disrupt these signals. Didn't know that. I will send that one to my doctor. See if we can get some medication to disrupt these signals. Some researchers have also suggested that changes in the levels of other hormones, such as cortisol, which is released when the body is under stress, may contribute to fibromyalgia. A couple of weird causes that I found along the way in my 15-16 years. I once read a Swedish study that was stating that the cause for fibromyalgia, did you see that? Was that it was the nerves in the hands, back of the hands, that were causing the fibromyalgia pains. That study has since disappeared. There's also a second study that I've just come across that states that if your neck's curved, especially when you're stood up, so you've got a bit of a curved neck, it can compress the channel sending signals to the brain, therefore basically, you know, interrupting the signals. If you think about when you get a cable caught in a door, and it does that sort of kinky thing, the same sort of thing happens with your neck. That's kind of quite interesting, because I've always thought it's something to do with your neck around. Obviously that's where everything sort of goes into your brain at that point, and I actually do have a slight, not a hunch, but just I actually stand quite straight, but just at my neck it does curve over, so maybe I have something there. I've written something here. Facts: fibromyalgia can be hard to spot in children because it's much more common in adults. Most of the time fibromyalgia affects women over the age of 18. Even so, between 1 and 7% of children are thought to have fibromyalgia or similar conditions, which is my biggest fear. If you've seen my other videos, absolutely hate the fact that any of my children can actually get this from me. Freaking nightmare. But it may be worth you thinking about your own children. Have they shown signs of it? I'm obviously hoping not, but keep in mind. Symptoms resemble those of arthritis, but fibromyalgia affects the soft tissue and not the joints, even though it feels like your joints are being tightened up so they can't move, like on me. Common symptoms of fibromyalgia include widespread pain, understatement of the year, jaw pain and stiffness. I've never had that. Never had that. Maybe you guys have had that. Pain and tiredness in the face muscles and adjacent fibrous tissues. Well, that's not certainly down to laughing. Stiff joints and muscles in the morning. Headaches, irregular sleep patterns, irritable bowel syndrome. Not had that, thank God. Painful menstrual periods. Nope, not had that, thank God. Feel so sorry for you ladies out there. Tingling and numbness in the hands and the feet, specifically on the left hand side for me. Restless leg syndrome. Sensitive to cold or heat. Got that. Difficulties with memory and concentration, known as see what I did there? Fibrofog. And fatigue. And fatigue is really the freaking understatement of the year. Something I think I've written a little bit later about fatigue. Yeah, I have, so I won't go into that now. But the following symptoms are also possible if that list wasn't enough. Problems with the vision, nausea, pelvic and urinary problems, weight gain, dizziness, cold or flu-like symptoms, skin problems, chest problems, depression and anxiety, and breathing problems, to name a few, of course. While I was sort of getting all this information together, dear God, the amount of symptoms are just bonkers. So you can do your own internet searches if you want more information about that. Diagnosis, ruling out other conditions, and this is pretty much how they diagnose fibromyalgia. That's by rule out everything else, and what you're left with can only be fibromyalgia. I still to this day do not understand why they do fireworks in the daytime in Malta. There you go. If your GP doctor thinks that you may have fibromyalgia, they'll first have to rule out all other conditions that could be causing your symptoms. These conditions include chronic fatigue syndrome, a condition that causes long-term tiredness. They need to rule out many things. Rheumatoid arthritis, multiple sclerosis. However, the chronic fatigue syndrome, also known as ME, I didn't know I even had that. I just thought that my chronic fatigue was down to the fibromyalgia. Well, it turns out it can also be a separate condition. And some of the symptoms for CFS is also fatigue, loss of memory or concentration, sore throat. I always get sore throat constantly. Enlarged lymph nodes in your neck or armpits. Are they here? Nope. Unexplained muscle or joint pain, fibromyalgia. Headaches, fibromyalgia. Unrefreshing sleep, fibromyalgia. Extreme exhaustion lasting more than 24 hours after physical or mental exercise. I suffer really badly with that, but since I moved to Malta it's less. But in Norway, 3 months in bed, I was useless. Could barely get to the bathroom, I was that bad. So think about it. Is it a case of you get up for the morning and 4 hours later you need an afternoon sleep? That's apparently not normal fibromyalgia. That is an additional CFS, chronic fatigue syndrome. So lucky you if you do have to sleep after 4 hours of getting up in the morning. You have two conditions. Wow. Such good news I bring you. However, maybe as that's named ME, maybe that will give you a better chance with your social office stroke system to get unemployment benefit, because had I have known that in Norway, having ME as well as fibromyalgia, maybe it would have been easier to get sickness. I don't know. Tests to check for some of these conditions include urine and blood tests, although you may also have to have x-rays and other scans. If you're found to have another condition, you could still have fibromyalgia as well. So, you know, if they find out you've got arthritis, you could still have fibromyalgia. That's just the way it is, I'm afraid. I had x-rays, I had a CT scan, and I also had a spinal tap. They're not nice. Now, the criteria for diagnosing fibromyalgia, other than what we just discussed of ruling everything out and you're left with fibromyalgia, is the tender points. But I'll quickly go through this. For fibromyalgia to be diagnosed, certain criteria usually have to be met. The most widely used criteria for diagnosis are you either have severe pain in 3 to 6 different areas of your body, or you have milder pain in 7 or more different areas. Your symptoms have stayed at a similar level for at least 3 months. No other reason for your symptoms has been found. The extent of the pain used to be assessed by applying gentle pressure to the tender points where the pain is likely to be at its worst. Now, when reading up on fibromyalgia, you may have come across the term tender points. These are certain areas of the body which fibromyalgia is said to cause the most pain. These include the back of the head, inner knees, the outer elbows. Pain can also be increased in the neck and shoulders, the outer hips, and the upper chest. Doctors used to diagnose fibromyalgia based on how they react to the pressure at these points. However, this is no longer seen as an accurate way to diagnose the condition, and tender points are no longer used as a reliable indicator of fibromyalgia, apparently since 2016. I only just found this out. Okay, let's get into the treatments. Now, please listen to these words. The treatments are very wide, very broad, and for each treatment, maybe 5% have effect to it. You know, it's not one of those things that a certain tablet helps everybody, or a certain thing like acupuncture helps everybody. It's not like that with fibromyalgia. Me, myself, I've said it several times before, not one day in the last 16 years has been the same, and that's also the same for the medication, for, you know, other treatments, for exercise. I 16 years, I still don't know how to handle my illness. I can balance it, but I haven't figured it out yet. Anyway, treatment. Medical attention is needed because fibromyalgia can be difficult to manage. No shit, Sherlock. It is a syndrome. Each patient will experience a different set of symptoms. An individual treatment plan will be necessary. An active exercise program. Now, I know a lot of you out there have troubles getting up out of a chair, let alone exercising. I myself, as I just mentioned, was in bed for 3 months. Since I started exercising, things have changed. I'm not lying. I find it easier to get around. I'm a lot more active. I'm in bed less, and my pain is reduced until the evenings. Then the shit hits the fan, no matter what I do. But I do sleep better because I'm more tired as well. So it has a knock-on effect. So something to keep in mind. It's not that I don't trust my equipment, but I am just going to quickly check. Function cannot be used at this time. I'm just going to quickly check it's still recording. Apparently it is. At least I bloody hope so. I'm going to leave that there so I can see what's going on. Okay. Right. Where were we? Yeah. Acupuncture. Some patients have experienced improvements in their quality of life after starting acupuncture therapy for fibromyalgia. The number of sessions required will depend on the symptoms and their severity. One study found that 1 in 5 people with fibromyalgia use acupuncture within 2 years of diagnosis. The researchers concluded that it may improve pain and stiffness. However, they call for more studies. For me, because as we've discussed, you probably know, the pain of a simple graze on the leg feels like a broken leg and stuff like that with fibromyalgia. When I was having the pins put in, tiny little pins, they felt like knives going in. I think the most I had at any point was over 20. And it felt absolutely horrendous. And I think I went to 9 sessions before I gave up completely because it was causing so many problems. I literally was like this before going in there because it was horrible. And what's worse is that they then say, "Oh, Mr. Robinson, there we go, they're all in now. Please lay back and relax for 30 minutes. What? You get frickin' 20 plus knives in your body and relax. Anyway, moving on. Psychotherapy. I've done that. I think I did that. Couple of sessions. No, maybe more than that, 4 or 5 sessions, but didn't help, I'm afraid. Behaviour modification therapy. I haven't done that, other than what my wife has done since we got married. And yeah, right, moving on. Chiropractic care. Went to a chiropractician. Whatever. Didn't help me at all. And that cracking's really unnerving. Massage. Yeah. Physical therapy. Went to several. Didn't help. Caused a lot more problems than it did solve. And aromatherapy. I've not done that yet. Doesn't mean I won't try it, but anyway. The behavior modification therapy is a form of cognitive behavioral therapy that aims to reduce negative, stress, or pain-increasing behaviors and improve positive, mindful behaviors. It includes learning new coping skills and relaxation exercises. And of course, low-dose antidepressants, although these are not a first-line treatment. People with fibromyalgia need to work with a doctor to come up with a treatment plan that provides the best results. And that moves me on to drugs and medication. Now, full disclosure, I am not a doctor. This is just information I've sort of got myself or off the internet. Please be aware of that. Now, drugs may be recommended to treat certain symptoms. These may include over-the-counter, OTC, pain relievers. However, the European League Against Rheumatism, Jesus, John, the ULAR, issued a recommendation against using non-steroidal anti-inflammatory drugs to treat fibromyalgia in their updated 2016 guidelines. Antidepressants may help reduce pain. Anti-seizure drugs such as neurotonin and Lyrica may be prescribed. These are normally used to treat epilepsy, but research has shown that they can improve the pain associated with fibromyalgia in some people. Didn't work shit with me. However, a review has suggested that patients often stop using these drugs because they are not effective in relieving pain or because of their adverse effects. That's what happened to me. Right, painkillers. Simple painkillers that are available OTC from a pharmacy, such as paracetamol, can sometimes help relieve the pain associated with fibromyalgia. Doesn't do shit with me. The OTC painkillers aren't effective. Your GP or other healthcare professional treating you may subscribe. However, if you'd like to subscribe to my channel, may prescribe a stronger painkiller such as codeine or tramadol. I use coldamol, which is basically the codeine, every day. The tramadol didn't do shit with me, no matter how many handfuls I chucked in my gob. These painkillers can be addictive, and their effects tend to weaken over time. This means that your dose may need to be gradually increased, and you could experience withdrawal symptoms if you stop taking them. Other side effects include diarrhea and fatigue. The irony. Now, you can also take medication to help you sleep. As fibromyalgia can affect your sleeping patterns, you may want medicine to help you sleep. If you're sleeping better, you may find that other symptoms aren't as severe. I have mentioned before that I use Nitol, half a tablet on the nights that I require it. That's only when I get really desperate, 3 o'clock in the morning type thing. I try not to take it on a regular basis. It does help me the day after. I don't I don't wake up feeling refreshed as such, but maybe less fatigued. Muscle relaxants. If you have muscle stiffness or spasms as a result of fibromyalgia, your GP may prescribe a short course of muscle relaxants such as diazepam. These medicines may also help you sleep better because they can have a sedative, sleep-inducing effect. Now, on to the last one that I've done, and it's controversial for me because it's diet. And having this illness, sometimes when I'm in extreme pain, knackered, the only thing that makes me feel even minutely better is a bar of chocolate or some sweets. And I know that that's a catch-22 because half an hour later I'm in more pain. But I still can't stop it, and I don't think a lot of people out there can stop eating sweets and chocolates and whatnot. However, recently I've been thinking a lot more about it, and I was thinking about taking a short journey on my channel of cutting out certain foods, gluten and sugars and all of that malarkey, and see how I got on. What I wanted to do though was start slow and just start a daily diary of what I'm eating and seeing if something specifically flares up my symptoms in any way, but let's see how we get on with that. Right, dietary measures have been suggested for improving the symptoms of fibromyalgia. Still recording, perfect. I can autofocus here, that's handy. These include high energy foods that are low in sugar. Foods such as almonds, beans, oatmeal, avocado and tofu contain plenty of fiber but no added sugar. These can help boost energy throughout the day, helping to improve tiredness, symptoms that occur as a result of the condition. Interesting. Everything on that list except avocado and tofu, i.e. oatmeal, beans and almonds, I'll try. Avoiding foods that have gluten. A 2014 study that's got a link here that I can click has suggested that gluten sensitivity can contribute to fibromyalgia. This has been said to me many a time before. I have to look into this. I have to. Oh god, I can see a video coming up with that. So I'm going to miss everything. Anyway, the study showed that removing foods that contain gluten from the diet may be able to reduce the pain, even in patients who do not have celiac disease. This is also linked to a diet plan for reducing inflammation. Cutting out fermentable saccharides and polyols. FODMAP. Why didn't I just say FODMAP? A recent study showed that a diet in a low FODMAP could have promising effects on pain levels in people with fibromyalgia. FODMAP. I don't know what foods contain FODMAP. I will do a quick internet search when I'm editing this, and I will post the results here, or there, or maybe over the whole screen, depending on how many they are. Right, the next one is not eating additives. One report showed that cutting out additives from the diet, such as aspartame and monosodium glutamate, can reduce pain significantly. Didn't know that. But I don't have anything with aspartame in. I don't know what monosodium glutamate is. I'll look into that as well. There. The pain of the people involved in the study was also shown to increase once these additives were put back in the diet. Again, another interesting one. And then the next and last one is eating more seeds and nuts. There is little evidence to support a direct relationship between seeds, nuts, and improvement in fibromyalgia symptoms. However, they are known to contain powerful debris with whatchamacallit effects that significantly reduce the stuff. And there you go. I think I have a page missing. Oh well. I covered most of what I wanted to cover. If you have any comments, please do so below, and I'll get back to you. I am going to look at the diet for sure and see if that helps me. And I hope that you've gleaned some information from this video. Have a fantastic day today. Wind's picking up again. Have a fantastic day today. I hope you're all well, and I'll see you soon. Take care of yourselves. Bye bye.